Health is a fundamental human right, but our country, America, has a problem with race and health outcomes. As the COVID-19 pandemic recently reminded us, people of color were disproportionately burdened with infections, hospitalizations, and death. These alarming health statistics are not unique to COVID. Here's the thing, if we truly want to eliminate health disparities by race, there's a few things that we need to do. Without question, we need to address the social determinants of health, systemic racism in healthcare, and the high cost of healthcare. But we also need to turn our attention to addressing the lack of racial diversity among health professionals, especially public health professionals. Public health professionals are responsible for the health of the nation. They do this with prevention and health promotion. And graduates of schools of public health who hold advanced degrees, they go on to work as researchers, policymakers, professors. They lead health departments at every level of government. The goals of eliminating health disparities and achieving health equity, it's central to their role. But our country is failing on that mission. Just look at any health statistic by race and you'll see what I mean, including those about Black women dying from birth at a higher rate than anyone else. Obviously, diversity is not a cure-all for everything, but it is an important factor in this equation. In fact, research tells us that diverse teams are better equipped at solving problems than teams that are not diverse. Yet graduates from schools of public health remain overwhelmingly white and Asian. A 2020 study looking at graduation rates saw that only 14.5% of graduates were Black and Latino. My research seeks to change that. For part one of my research, I surveyed all 60 schools of public health in the United States. And I asked them about their recruitment and admission practices to increase diversity on their campuses. And for part two of my research, I looked at recruitment and graduation data from 2010 to 2020 at all schools of public health. For my quantitative data results, I saw that there was only a 5% change in the level of master's degrees being awarded to Black and Latino students, but there was no significant change in the number of doctoral degrees being awarded to Black and Latino students at schools of public health. And for the survey that I sent to each school of public health during the height of the pandemic shutdowns, it was evident that schools were still struggling with how to increase diversity on their campuses. But we need to solve this problem, and we need to solve it now. The nation is becoming more diverse, and there are no signs of this slowing down. A more diverse workforce has many benefits, including greater levels of trust from people experiencing the highest burden of health disparities. Our nation will be better able to understand and address the complex social, cultural, and economic factors that put some people at greater risk than others. And finally, communities of color will be more inclined to adopt some of these changes. But the missing link is we need more people of color, Blacks and Latinos, among public health professionals. After all, we are the ones who are being disproportionately burdened by health disparities. So our voices, our experiences, our expertise, it matters, it counts. We need to be at the table. We need to be represented among the next generation of public health professionals in the United States. Thank you.